Hey Tina, this is Ryan. This is upper extremity elbow exam video B, and
C.
oh no, this is C. Correct. This is C,
Sorry, I'll be
and and we're gonna be doing in this video special test for sprains, special test for joint instability, and special test for neuropathy. So first things first is we're gonna test for lateral epicondylitis. So I'm gonna ask her to, or I'm gonna position her elbow to 45 degrees flexion. I'm going to stabilize the elbow with this hand, and then I'm going to resist wrist extension. So I'm gonna ask her to push against my hand like this. If there is increased pain over that lateral aspect of the lateral epicondyle, then that's indicative of a positive test. And that can mean that the person might have lateral epicondylitis. Another test that goes along with the lateral epicondylitis test, or test for lateral epicondylitis, is the resistive tennis elbow test. So I'm gonna ask her to go on the ground because of treatment table and space. We want the we want the forearm to be relaxing on the table, and I'm gonna stabilize the elbow right here. Normally you'd want the patient either sitting or standing, but their forearm to be on the table like this. We're having her kneel based on where we're at. I'm going to stabilize the elbow, and then I'm going to resist middle finger extension, like so. If there is any increased pain with that lateral epicondyle, then that's indicative of a positive test. You can sit back up on the table.
Thank you.
Next thing we're going to do is the test for medial epicondylitis. So this one is going to be same positioning, so we're going to have them seated. Then we're going to do elbow flexion to 45 degrees about there. And then in this setup is resisting wrist extension, I'm going to be resisting wrist flexion. So I'm going to have her push against, perfect, while stabilizing the elbow with this hand, perfect. And if there's any increased pain on the medial epicondyle, that's indicative of a positive test, and that could mean that the person might have medial epicondylitis. So joint instability is next. I'm gonna do like varus and valgus kind of together because they're kind of the same thing. We just, based on where your hands are and what, I'll go into that later. So for the valgus test, this is gonna be for your MCL. So this is testing for any MCL damage. And I'm gonna have elbow be in about 20 or 30 degrees flexion. And I'm going to have my wrist on the medial side. I'm gonna grab the wrist on the medial side, and I'm going to grab the upper arm on the lateral side. And I'm going to provide a force while also trying, both for valgus and varus, I'm going to avoid allowing the humerus to externally rotate or internally rotate. So I'm going to do these motions without doing that. And if there is any increased pain or increased movement with a valgus stress test, then that's going to be indicative of MCL damage. And then if it's a varus stress test, I'm going to switch my hand placements. So my hand is going to be on the lateral side of the wrist now, and the medial side of the upper arm. And I'm going to, also avoiding internally and externally rotating the humerus, I'm going to provide a force both directions. And if there is any reproduction of pain, or if there is increased movement with that varus slide or varus stress test, then that's indicative of LCL damage. The last joint instability test that we have is going to be your hyperextension test. So I want to mention this. You want to check bilaterally, and I'm not going to do that for the sake of the time in this video, but I want to make sure that you know that you should check this bilaterally. Ow. I'm going to have one hand firmly grasped on the lateral and medial epicondyles, and then I'm going to have my other hand on the wrist, and then I'm going to passively extend the elbow until there's no further motion. And it's going to be a positive test if it goes past or beyond 0 degrees extension for the elbow. And a positive test could mean hyperextension and also torn or stretched anterior capsule. The last thing we're going to be doing, the last special test, is for neuropathy, and this is Tinel So Tinel I'm going to be tapping, I'm going to have the patient sitting, just like so. I'm going to be tapping the ulnar notch between the olecranon process and the medial epicondyle, which is right here. I'm going to tap that once. I'm not going to tap it repeatedly because that's going to be too much sensory overload. And it's going to be a positive test if there's any tingling or any burning sensations down the forearm, wrist, and fingers. Forearm, hand, and fingers.